Good afternoon, class. This is the video post for chemical addiction class discussion question number 6. With that being said, I wanted to discuss the first question, which is which of the biological models theories make the most sense to you when understanding addiction? As I read our reading for this week, I began by the definition of the bio part of the biopsych social model. And it made sense to me because it says the biological components of the biopsychosocial model are anatomical, structural, and molecular substrates of a disease. And it made sense to me for it to be biological because when we really think about it, it has a factor on our body. It changes what's on the inside of us. It changes our chemistry. It changes the way our body functions. And so, with that, I believe to be true that there are biological factors that take place when it comes to addiction. With that being said, the first model I wanted to look at was the Jelinek work. In his work, he indicated that that alcoholism is a disease just like cancer or pneumonia rather than a moral weakness. A lot of people were thinking of alcohol as a moral weakness, but in reality, it's more of a disease. And with that being said, Jelinek went over 4 different stages in which a person can exhibit. The first stage is the pre alcoholic stage, which states that the individual's use of alcohol to self medicate social tensions, frustrations, and anxiety. I'm a firm believer that a lot of times people use alcohol just to alleviate some of the things that's going on in their minds and in their lives. With that being said, his second stage was to the individual continues to engage in relief drinking. Basically, when it talks about the person is experiencing blackouts and they have guilt over their alcohol intake, and they have the urge, excuse me, to hide their drinking. And I believe that to be true. Once a person kind of falls into the slope of just drinking to avoid tensions in life, a lot of times people don't realize that tensions are in our daily life, and because it can be in our daily life, uh, the drinking tends to increase, and because of the fact that they see it starting to increase, a lot of times out the human nature first dynamic is to hide it. And so I believe that to be adamantly true. And then he talks about the third step, which talks about the individual eventually becomes physically dependent on alcohol, and it's not so much of they're doing it to avoid pressure. It's just the fact that it's become such a habit to them. It's habitual to them that they continue to do it, and they become dependent on it. It's almost like they look forward to it in order to be able to endure their day. And then his final step is that the person enters into the chronic stage of alcohol use, and this is where they find substitutes. If alcohol is not available, then they'll substitute it for something else. They'll also have physical symptoms of tremors, and then they'll also just go to events where they know drinking will be permissive. So I believe that to be one of the models that made sense to me because I could see the progression of how alcoholism can take effect. It can take effect just from the early stages of just trying to relieve tension, and then it just continues to grow and it grows and it grows until it becomes a chronic stage. Another model that made sense to me was the neurobehavioral, excuse me, theories that Dwelski talks about in his book, and it made sense to me because Dwelski says that according to this theory, drugs of abuse alter the normal neurochemical balance within the central nervous system, especially those involved in the reward system. A lot of times, when behaviors or habits are picked up, it's usually because there is a reward that comes with it, not a so much a physical reward, but sometimes just an emotional reward. They feel happy. It alleviates the tension, and because it alleviates the tension, then they want to replicate that same reward pattern for them. So I those were the two models that made it make sense to me in regards to addiction and how a person can become addicted. One, because of the fact that it's something that can happen in pattern stages, but then also too because of the fact that the brain is triggered in the reward system, and that's why biologically it has that effect on an individual. The second part to our discussion question asks, which of the psychological models and theories make the most sense to you when understanding addiction and why? And so when I looked at the psychological components of the biosocial model, it said the definition was by Dwelski. The psychological components of the biopsychosocial model explores the impact of psychodynamic forces, learning, motivation, interpersonal interaction, and personality on how an individual's substance use behaviors. I'm a firm believer that it's a learned behavior. It's not something that somebody just wakes up to one morning and they say, oh, well, I think I'm going to try this. In reality, I really believe it's a learned behavior, whether it's learned from what they've seen and a positive effect, or whether it's something that they've learned based on their own personal experience. And with that being said, one of the models that really made the psychological component of it make sense to me was the coping systems theory. And it talks about the psychoanalyst theory suggested that the afflicted individual uses alcohol or drugs to numb themselves to emotional pain. And that's from Frattori, 2001, Horne, 1964, or to self-medicate anxiety disorders. And that's from Encrenas and et al., 2009. And I'm a firm believer that that is the case, that it is used as a coping mechanism, because a lot of times we are not always taught the proper way to cope with the realities of life. And a lot of times people are taught that they have to figure it out on their own. And because some people just do not have that ability to be able to figure it out on their own, they found that alcohol or drugs was the way that they were able to cope with life pressures. And the final theory that made the psychological component make sense to me was the addictive personality. And the addictive personality talked about according to Dwowski, that drawing upon clinical experience with persons who were addicted to alcohol or drugs, a number of writers suggest that personality traits such as impulsiveness, thrill seeking, rebelliousness, aggression, and nonconformity were robust predictors of alcoholism. And that was quoted by Slutsky et al., 2004. And I'm a firm believer that alcohol and drugs is an addiction. And because of the fact that a person does have an alcohol or drug use issue, so it gets to the point where a person may no longer be doing it because they enjoy it or because the reward system is being triggered by it, but it's because of the impulsivity that comes behind it. You know, it might be 5 o'clock in the evening and somebody is saying, I'm used to doing this at 5 o'clock in the evening. I'm used to having that drink at 5 o'clock in the evening, or at 10 o'clock at night. I'm used to having this particular drug. And it becomes that impulsivity because of the fact that it's connected to something. Sometimes it could be a time. Sometimes it could be a place. Sometimes it could be an event. Sometimes it could be a memory. And I believe that all these different things bring about that addictive piece in it because of that impulsivity. I can even go as far to say that even a person who may not be addicted, but they may experience impulsivity, is not because of something that they want to do because of the reward. It's just the feeling that they get from that impulsivity that they want to alleviate that feeling of impulsivity. And so in order to alleviate that impulse of impulsivity, they'll do whatever it is that the impulsivity is driving them to do. The downside of it is that the person will end up being impulsive again, and they'll end up repeating the same behavior over and over again. But to me, it made sense. It made alcoholism and drug abuse make sense because it gets to the point where a person doesn't do it for the reward, but they're doing it for the impulsivity and to alleviate those symptoms of the impulsivity. And so that's why the biopsychosocial model made sense to me, specifically through the biological factor as well as the psychological factors. Thank you guys for listening. I look forward to seeing you soon. Take care now. Bye.